Dr. Jennifer Mullendore, Medical Director of Buncombe County Health and Human Services. And I'm here today to give some safety tips after a hurricane. So first we're going to talk about water safety. So access to safe water is a top concern. We want to make sure that your source of water is clean and safe to prevent illness. Water may not be available in all areas. In other areas, water may be available, but not safe to use in normal ways. Water treatment systems are under boil water advisories as they resume service after the storm. Drinking water wells that had water over the top of the well at any point are considered flooded. Flooded wells can be contaminated with chemicals, animal waste, and human sewage. If your well was flooded or damaged during the storm, you must disinfect the well. Instructions for disinfecting wells are available at buncombeready.org. After disinfecting your well, you should contact Buncombe County Environmental Health for water testing by calling 828-250-5016. Do not use contaminated water to drink, wash or prepare food, make ice, prepare baby formula, wash dishes, brush teeth, or wash hands. Use bottled, boiled, or treated water for drinking, food preparation, cooking, washing dishes, brushing teeth, bathing, and washing hands. So if you don't have safe bottled water and you have a way to boil your water, that will make it safe to drink. First, if the water is cloudy and you're able, filter it through a clean cloth, a paper towel, or a coffee filter. Another option is to let the particles settle to the bottom of the container and then take off the clear water from the top. Bring that clear water to a rolling boil for 1 minute. And then let the boiled water cool, and then store it in a clean, sanitized container with a tight cover. Do not use gas appliances in an enclosed space to boil water due to the risk of carbon monoxide poisoning. If you can't boil water, you can disinfect it with household bleach, which will kill some but not all of the disease-causing organisms that may be in the water. Again, if the water is cloudy, filter it through a clean cloth, paper towel, or coffee filter, or allow it to settle, and then take off the clean water from the top. Add 8 drops of regular, unscented, liquid household bleach to each gallon of water. Stir it well and let it stand for 30 minutes before use. Store this disinfected water in clean containers with covers. Next, I'm going to talk about wound care. So the risk of injury during and after a hurricane and flooding is really high. And any open cuts or sores should be kept as clean as possible by washing them thoroughly with soap and clean water if you have access. Then you want to cover that clean sore or cut with a bandage to reduce the chance of infection. You should seek immediate medical care if the wound becomes red, swollen, starts oozing, or if you have signs of infection like fever, increased pain, shortness of breath, a fast heart rate, or confusion. You should also seek medical care if there is a foreign object like wood or metal or dirt embedded in the wound, or if the injury was caused by an animal bite or a puncture from a dirty object. Additionally, if you have a wound, you may need a tetanus vaccine if it has been more than 5 years since your last one. Finally, I'm going to talk about getting back into your home safely. So a building that has been flooded can be dangerous. And here are some recommended tips when going back into a water-damaged building. First, wear a hard hat and safety goggles when there is the danger of falling materials. Wear leather work gloves to protect from cuts, or rubber gloves to protect from chemicals. Wear an N95 mask, a respirator, to protect against dust and germs. Don't assist with cleanup efforts or wear masks if you have underlying health conditions like heart problems or breathing problems that could be made worse by these activities. Stay alert. Accidents happen when people get tired, so take breaks. Drink plenty of clean water to avoid dehydration. Avoid contact with power lines, and take extra care when you're cutting trees or branches that are bent or caught on other objects. Be careful lifting objects. Have teams of at least 2 people to work together to lift heavy or bulky objects. And get help with potentially hazardous materials. If you smell gas or a chemical odor, or you see a spilled container of hazardous material, leave the area and call the fire department. Air out buildings by opening doors and windows. Use fans if you have power to help dry wet areas, and position the fans so they're blowing air outdoors. Throw out anything that cannot be cleaned and dried quickly. Things like mattresses, carpets, carpet padding, rugs, upholstered furniture, stuffed animals, pillows, any things that can't be cleaned and dried easily and quickly. Remove and discard drywall and insulation that was flooded. Thoroughly clean all wet items and surfaces like floors and furniture and countertops and appliances with hot water and detergent. And before moving back into a flood-damaged building, that building really should be completely dry. Dirt and trash left by the flood should be removed from the building. And moldy or mildewed items must be completely clean and disinfected or thrown away. If not, mold and mildew will return and possibly cause health problems. If you're going to clean up mold, you can use a mixture of 1 cup of household bleach with a gallon of water. When you're using bleach, you never want to use it in an enclosed space, so open windows and doors first. Following these tips can help you stay safe as we recover from Hurricane Helene. I wish you all well, and I wish for the safety and health of your families.